Do you grind your teeth at night, wake up with loads of jaw tension, find yourself massaging your cheeks during the day, or even get headaches? Or maybe your dentist has told you that you grind, but you're not aware of it. Hi, I'm Dr. Alison Wu, physical therapist and board-certified clinical specialist in neurologic physical therapy. Let's talk about your temporomandibular joint, or commonly known as TMJ, and exercises you can do to help. So without further ado, let's jump into those exercises. Most importantly, hold your double chin and keep your neck in a stable position. We're going to take a towel and pull our tongue and stretch it out. It helps to get to know your tongue and see which side is tighter first by pulling it straight out, to the left, to the right. You can go straight up, top left, and top right. So for mine, pulling straight to the left and top left is the tightest. Then what you can do is take your finger and you're going to push downward and slowly ease all the way to the back and side of the tongue to release and help loosen your tongue. You want to start at the front and move slowly all the way back, all the way as far back as you can. And now pulling my tongue is not as tight. Nice. So after you get your tongue looser, then we're going to get it stronger. Make sure to keep holding that double chin. You don't want to be out here. So that your tongue and your neck stabilizers are working together. These exercises for tongue strengthening are helpful to do in front of a mirror. In front of the mirror, the challenge with your tongue and cheek is to not let your jaw drift with your tongue like this. Okay, so try to get your tongue into your cheek without moving your jaw. Try to use your hand gently underneath your chin to help yourself feel what your chin is doing. Then try opening, closing your mouth 5 times. When this gets easy and you don't need a mirror, you can give yourself a little resistance to actually make it harder to your tongue. "10 seconds, 5 times on each side. The most important thing is don't overpower your tongue so you're using your neck muscles to do this sort of thing. The neck muscles should not be working hard at all. If you can't help using your neck muscles, maybe do this leaning back with a little headrest or laying down so your neck relaxes and see if that helps. Try not to use your neck muscles. Have you ever felt your tongue muscle burn? 10 seconds, 5 times will get it burning. It's the weirdest feeling. I like to do this in my car when I'm driving. The next exercise is tongue clicking. Use a metronome to click to. Phone, Google. You're going to try to do that 20 seconds, 5 times, and increase your metronome speed. Or you can click as long as possible in the car, 3 to 5 sets, maybe even to music. Make sure you get a nice pop, not a tisk, and really actually try not to use your jaw with it. After stretching the tongue out, it's really, really important to strengthen your tongue. Stretching the tongue will get it more flexible, but not stronger, which sometimes causes more jaw clenching and breathing challenges because at night the tongue is flopping to the back of the throat and plugging you. So really make sure, if you stretch the tongue out, do the exercises with it. This last exercise is called your eye smooth pursuit exercise. This will help loosen your cranium, as the eye socket is composed of 7 cranial bones, and there's a lot of muscles in the eyes to help alleviate some of the headaches. First, you put your finger to the front, and you follow your finger all the way down. Make sure you can still see the tip, not so far that you're using your peripheral vision. Make sure your eyeballs can actually see the nail. So I'm about here, follow to the right, all the way up to the corner, as far as you can. If there's a corner that's harder, hang out there for a little bit longer to kind of stretch it out. And get up to the middle, and come nice and slow to the bottom. Then you can switch fingers to draw the other side of the window. I'm about here in terms of my limit, and come on down. You do about 3 to 5 windows on each side. This will help loosen your eyes and strengthen your eyes and relieve some of the tension in your head. My myofunctional therapist friends will tell me that I have plenty to work on in my mouth, especially with my clicking. I definitely do. Be sure to consult with a skilled myofunctional therapist and airway specialty dentist or orthodontist for further tongue, mouth, lip strengthening, and tongue tie, teeth assessment to help alleviate your jaw grinding and tension. It's important that we have a collaboration, teamwork effort here to help you recover the most holistically. Hopefully you've already noticed some changes after trying these out. Let us know your feedback, any questions in the comments box below. I'm Dr. Alison Wu. Remember, we heal smarter, not harder.